Okay, let's unpack this. We've all heard about the challenges facing healthcare, right?
Definitely. Staffing is a huge issue globally.
But have you ever wondered what actually keeps doctors, committed,
Hmm.
especially in those areas that really struggle to get staff?
Yeah, the places where it's toughest.
So today we're doing a deep dive into this really fascinating qualitative study. It's from BMJ Open,
Uh-huh.
and they interviewed 100 NHS doctors in England. That's the National Health Service in the UK.
Right, a big public system.
And our mission here is to figure out the organizational factors that encourage doctors to stay. We're kind of flipping the usual script.
Exactly, because so much research looks at why doctors leave. Burnout, attrition, all that.
All the negative stuff.
Yeah. But this study specifically asks, what makes them stay? What makes the job bearable, maybe even good, despite the pressures? It's a really important angle.
It feels critical, especially with this whole healthcare workforce crisis we hear about.
It is. High vacancies. The UK having fewer doctors per capita than some comparable countries.
And it's often worse in certain areas, right? Like socioeconomically deprived places often have fewer doctors, but actually more need.
Precisely. So understanding what keeps doctors in those specific places is vital, not just why they might bail.
Okay, so let's get into it. What did the study actually find? What keeps them there?
Well, they boiled it down to two main themes. The first one was feeling valued.
Feeling valued. Okay. Does that just mean pay?
Not just pay, no, it's deeper than that. More about a meaningful commitment from the organization.
How so?
Doctors talked about things like dedicated time for training, proper support from colleagues, especially with complex patients, feeling like part of a supportive team.
Right, the professional side of things?
Yes, but interestingly, they also mention like really basic stuff.
Basic stuff, like what?
Like accessible car parks, canteens being open 24/7, things that just make the logistics of a demanding job a bit easier.
Wow, car parks and canteens. You wouldn't immediately think of those as retention tools.
And maybe not, but think about it. If those basics aren't there, it sends a message, right? Like your time and basic comfort don't matter.
Yeah, I can see that. It's symbolic.
Totally. One resident doctor mentioned added extras, like a small 100-pound bonus. A Christmas hamper made them feel less like just one of the numbers.
So small gestures can actually have a big impact on feeling seen.
Exactly. And one GP, that's a family doctor, put it really well. They said organizations shouldn't just aim to retain staff, but to nurture and sustain them.
Nurture and sustain. I like that. It's a much more positive framing.
Yeah.
Okay, so feeling valued was the first thing. What was the second?
The second was autonomy and opportunity.
Right, having some control.
Yeah, control over their job design, seeing clear pathways for, career growth. That kept people engaged.
Any examples of that?
Well, one consultant specialist really thrived in what they called a yes place.
A yes place.
Yeah, an organization that encouraged new ideas, that asked, what else would you want to do? It fostered initiative.
That sounds energizing.
It does. And what's also quite interesting, maybe even counterintuitive,
Uh-huh.
is that sometimes smaller, less prestigious hospitals or clinics actually offered more autonomy.
Really? You might think the big famous places would have more opportunities.
You might, but in smaller settings, doctors felt they could shape their roles more easily, maybe make a bigger, more direct difference to their local population. Less red tape, perhaps.
Okay, so maybe more flexibility to carve out your own path.
Exactly. Like one GP found a nice niche in a remote area by developing special interests. Another junior doctor felt a smaller, growing trust was actually better for their career than a huge, established one because they could have more impact.
So it's not just about the name on the door, it's about the real chance to contribute and grow.
Precisely. It's about influence and making a tangible difference.
So if we pull all this together, what's the main message here? What can, say, healthcare managers or policymakers take away?
Well, the study points to these practical things, these organizational levers, tangible policies, actual processes that can make doctors' working lives better.
Things you can actually do.
Right. It really underlines the power of creating a supportive culture, making doctors feel genuinely valued through the big things and the seemingly small stuff.
Like the parking?
Like the parking, and fostering that sense of autonomy, giving people space to grow and contribute meaningfully.
So it's not just one magic bullet, it's the whole environment.
Exactly. And these are modifiable things that can be changed to help keep doctors, especially where they're needed most. It's about sustaining that vital workforce.
It really shifts the focus, doesn't it? From just stopping people leaving to actively creating places where they want to stay and thrive.
That's the core insight, I think.
Makes you think. What really stands out to you listening about how feeling valued and having that bit of autonomy impacts job satisfaction? And maybe how these ideas apply outside of healthcare too, perhaps in your own job. Something to mull over until our next deep dive.